3M Cavilon Advanced Skin Protectant Application Technique Demonstration. Always follow facility requirements for infection control procedures, including hand washing and glove changes. Before you begin, set up your supplies on a clean surface. You will need the following items: 3M Cavilon No Rinse Skin Cleanser, several non-linting soft cloths, 3M Cavilon Advanced Skin Protectant, and 2 to 3 pairs of exam gloves. Next, open the package of 3M Cavilon Advanced Skin Protectant and leave it in the plastic pouch. Pre-moisten several wipes with the cleanser so you don't have to touch the bottle once your gloves become soiled. Alternatively, if you are using a bathing and cleansing wipe, you can remove several wipes from the package. Next, position the patient on their side. Expose the skin adequately for cleansing, but try to keep the patient covered as much as possible for warmth and dignity. If there is a lot of liquid stool, isolate it with either the soiled brief or the underpad before cleansing. Cleanse the skin thoroughly and gently with 3M Cavilon No Rinse Skin Cleanser. If areas of denudement are present, excess serous or serosanguinous drainage may be blotted with a gauze pad if necessary. Make sure you remove all stool from the skin. If this is the first time 3M Cavilon Advanced Skin Protectant is applied, you'll need to remove all previously applied barrier ointment or paste from the skin. Gently dry areas of intact skin if needed. Again, if the affected area is severely damaged and the skin surface is quite wet, you can gently blot excess moisture with a dry, soft, non-linting cloth or a gauze pad if necessary. After cleansing, change your gloves. This step is especially important if you have cleaned up a large amount of stool so that you don't transfer soil to the skin protectant. Now you're ready to apply the product. Pick up and grasp the applicator and place your thumb at the end of the lever. While aiming the sponge end of the applicator downward, firmly depress the lever to break the internal ampule. You will hear a snapping or popping noise when the ampule breaks. Keep the applicator pointed in a downward position for approximately 10 seconds to allow fluid to flow into the foam sponge. The fluid flows by gravity, so it's not necessary to maintain pressure on the lever. Notice that it's normal for the fluid to not completely saturate the foam sponge all the way to the edges. Now you're ready to apply 3M Cavilon Advanced Skin Protectant. Gently wipe the foam sponge across the affected area. Use a light, even sweeping motion with minimal overlap of the product as you move across the skin. This helps promote the drying of the product on the skin. Avoid wiping wet fluid over areas that have not yet completely dried. There is no need to push down on the applicator during application. Additional pressure is not needed and can result in excessive wetness or pooling of fluid. To facilitate easy application, the applicator may be used in any direction. Apply the protectant to damaged areas of the skin, as well as any areas of intact skin that could be exposed to stool or urine and are at risk for damage. Allow the area to dry for at least 30 seconds. If an area of skin is missed, wait until the fluid has dried completely before applying additional product. Each applicator will cover approximately 100 square inches or an area of about 10 by 10 inches. For larger patients, you may need more than one applicator. If the protectant is applied within a skin fold or an area of skin-to-skin contact, such as a gluteal cleft or groin fold, separate the skin surfaces to allow the fluid to dry completely for at least 30 seconds before allowing the skin to return to the normal position. If you're applying an adhesive dressing or tape over the skin protectant, make sure you allow the product to dry for at least 1 minute before applying the adhesive product. Cleanse the affected area promptly after every incontinent episode and as needed. 3M Cavilon Advanced Skin Protectant is waterproof and not removed by routine cleansing. The film will wear off and does not require removal. However, in the event you must remove the product, use an adhesive remover that contains hexamethyl disiloxane or HMDS. It's advisable to use an adhesive remover containing HMDS anytime you remove an adhesive dressing or tape from an area that has been covered with 3M Cavilon Advanced Skin Protectant. It is recommended to reapply 3M Cavilon Advanced Skin Protectant 2 to 3 times per week. For best results, create an application schedule such as a Monday, Thursday, or Tuesday, Friday for 2-time per week application, or Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday for 3-time per week application. More frequent application can result in product buildup on the skin. This concludes our demonstration of the application technique for 3M Cavilon Advanced Skin Protectant. Please contact your 3M sales representative with questions about the product. Thank you for watching.